Q10. Honourable Member for Ramsey, Mr Hooper.
Thank you very much, Mr President. I'd like to ask the Minister for Health and Social Care what plans he has for resumption of normal healthcare services on the island.
Honourable Member for Douglas North, Mr Ashford.
Thank you, Mr President. The Department has released a Back to Health document outlining plans for the resumption of normal healthcare services. A sister document, Back to Care, has also just been published. Both documents can be found on the website covid19.gov.il.
Supplementary, Mr Hooper.
Thank you very much, Mr President. I'd like to thank the Minister for that. I'm actually quite grateful that he has published those two documents. They're quite informative. I've had a lot of people contacting me very uncertain about how their individual care is going to be progressing, how services they personally rely on are going to be reopened and when and how. Without wanting to overload GP surgeries, who can these people call to speak to get some information about how services are going to reopen, rather than just pointing them to a particular document? And has the Minister considered widening the remit perhaps of the advice line that was used and is being used during the coronavirus cases?
Mr Ashford.
Thank you, Mr President. The Honourable Member in part has given my answer for me, because we are looking at potentially the widening of the advice line service that has been used during COVID-19 to cover some of this. We are, as quickly as possible, trying to get the individual clinic numbers back up and running as well, so that people can actually ring direct to the clinic that would be affecting them. I do have to ask, though, Mr President, that people bear with me and with the department, because while it has been very quick and very easy to turn things off, it's not quite so easy to turn things back on, because alongside getting back to normal healthcare services, we do need to keep some form of contingent response in case further cases of COVID-19 emerge. We can't just turn everything off and put it back. I know certainly there's been concerns for some people around elective surgery and how we are doing that. We are trying to get elective surgery back online in a managed way, and some of our services have already managed to restart. There are certain endoscopy procedures, such as capsule endoscopy, for instance, that are already up and running. And I know from speaking to several people who expressed concerns to me last week, this week, they have now started receiving letters from their clinics with new appointment dates. But it's not the same across all the services, and it is important that we work on our managed approach to be able to communicate with patients.
Supplementary, Mr Speaker.
Thank you. Is the Minister content that the Back to Health and Back to Care documents fully reflect the spirit of Sir Jonathan Michael's recommendations in terms of what the new normal should look like?
Minister to reply.
Thank you, Mr President. A very excellent point by Mr Speaker, because one of the things that has come out of COVID-19, one of the good things, is the way that we've already transformed some of our health services around e-clinics, around the fact that there's been more and more done by video conference, stuff that we've been told couldn't happen for many years. That has suddenly magically managed to happen and be put in place. So I think there's a lot of things there that we want to keep. I've made absolutely clear as Minister we're not just going back to the old normal. Those things have proved to be highly effective, and they must actually remain in place. So the one good thing I think that has come out of COVID-19 is some of the things identified in this Jonathan Michael review have been able to be done naturally over that period.
Supplementary question, Mr Hooper.
Thank you very much, Mr President. Actually, the Minister has just answered the question I was about to ask. How is he making sure that any of the good practices that have come out of the coronavirus crisis are going to be retained? Before we went into this, there were significant waiting lists in a number of key areas across the department and across our health service. And I think I'd just like to hear a little bit more as to about how he's going to make sure we are retaining some of these benefits to help shorten waiting times and make sure people can access the care that they need.
Minister.
Yes, thank you, Mr President. I'm happy to elaborate on that. So, for instance, one of the innovations that we've had is the 111 service, which we're very keen to repurpose and keep. We think that has been an absolutely excellent service. It has worked. Can I put on public record, because I haven't had a chance to do so, Mr President, while COVID-19 has been ongoing, my thanks to GTS and everyone involved in setting up the 111 line, because I think it's probably the quickest type of service that has ever been set up anywhere in the world in that regard. I know that when comparator jurisdictions tried to do it, it took 6 months to set up their version. We managed to do it in that number of weeks. In terms of video conferencing for so on, so for instance, certainly with GP consultations, if the GP doesn't feel it needs to necessarily be a face-to-face consultation, we would hope that they would keep with the telephone consultations, with the video conference consultations, so people aren't necessarily having to go into the GP surgery unless it is absolutely necessary. Up at the hospital, we've been working obviously with our third-party providers in the UK around video conferencing to make sure that only the essential people had to go over via patient transfer. I believe that service has worked very well as well, and that is something I've been absolutely keen on since day one when I became Minister of this department, and that is something we will also be looking to keep.